the sky is blue. And the T is for time, and it's also for tongue too. That's like one a newer symptom that they came out with. If they're able to stick out their tongue, but it's leaning towards the right side or the left side, that's a sign. And the T is also for time, because time is very crucial when a person is having a stroke. The sooner that they can get to the hospital, well, first somebody recognizing the signs and symptoms and can get them to the hospital, call 911 as soon as possible. They'll have a greater chance of surviving, and the doctors can kind of reverse the signs of a stroke. They'll also have a sudden severe headache, confusion, difficulty seeing, swallowing, walking, weakness and numbness on either side, the right side or the left side. And it can result, especially if they don't get to the hospital in the proper amount of time, it can result in paralysis and death. Okay, do anybody know the signs and symptoms of shock?
Unconscious.
Mm-hmm.
Pale, sweaty,
Mm-hmm.
lightheaded.
Yeah. Okay. They'll have pale, cool, moist skin. They'll be confused. Of course, they'll be unresponsive. They would usually have like a blank stare. They may feel restless, irritable. You may notice a blue tinge to their lips and fingernails. They may have rapid pulse, rapid breathing. They may have a drop in blood sugar. They may also have a dry mouth, but they'll be extremely thirsty and dehydrated. You do want to call 911, and if they're hot, extremely hot, you want to keep them cool. If they're extremely cold, you want to keep them warm, and you want to have them to lie flat. It's caused by not enough blood flow going into the tissues. It's caused by a variety of illnesses and infections, trauma, allergic reactions, dehydration. There are a few different types of shock. I'll go over them quickly. Hemorrhagic shock, that's severe bleeding. People that are like in the hospitals having surgery, they can lose a lot of blood. Ladies having babies, they can lose a lot of blood. In any type of situation where you're losing a lot of blood, that's hemorrhagic stroke. Cardiogenic shock, that's damage to the heart muscle. It can cause irregular heartbeat. Anaphylactic shock, that's a severe allergic reaction. I'll talk about that in a few minutes. Septic shock, that's a very deadly form of shock. That's pretty much blood poisoning. That's when bacteria and infections get in your bloodstream, and it can cause major damage to your tissues and organs, and you can die from that. People like cancer patients may get a bad infection or get septic from their chemo ports. Dialysis patients can get bad infections from their dialysis ports. Any type of situation, you can get bad infections during surgeries or any type of situation in the hospitals. So, like I was saying, septic shock is a very deadly form of shock, and you can die from that. Neurogenic shock, it mostly affects spinal cord injury patients. It can cause damage to your central nervous system. And also hypovolemic shock. That's basically severe dehydration. When people that don't get enough fluids and people that sweat profusely, they can go into hypovolemic shock. Even burn victims, they're at risk for going into hypovolemic shock as well. Okay, allergies, skin allergies. When people have an allergic reaction, they're going to break out into hives. They're going to be itching. You'll notice some flushing to the skin, red watery eyes, stuffy nose. Severe allergic reaction, that's anaphylaxis or anaphylactic shock. Of course, that is life-threatening. You'll notice some swelling to the face, The tongue, the lips, you may notice some shortness of breath and altered mental status. Have you all seen the EpiPen? Okay, you're going to remove the top, the blue top, and you're going to use the upper thigh. Let it click. Hold it for a few seconds and remove it. I'll let you all pass that around. Just squeeze the sides. Uh-huh. Okay, and also there is some over-the-counter medications that are good for allergies. That's Claritin, Zyrtec, and Benadryl. Claritin, Zyrtec, and Benadryl, those are good for allergies, those over-the-counter medications. There are a lot of different common allergies. Certain foods like nuts, eggs, and seafood and dairy products, wasp and insect stings and bites, latex and powdered gloves, certain medications, especially antibiotics, they can cause allergic reactions, cleaning products, colognes, perfumes, scented body washes and lotions, anything with latex in it, and animals. Those are the common allergies. Seizures. Have you all seen anybody have a seizure? No. Okay, there are different types of seizures. You have the grand mal seizure, the uncontrollable jerking, severe jerking. It's another one. It's where a person can stare. It's almost like a blank stare. They stare into space for a few seconds and then come right out of it. And it's another one. I call it the silent seizure because it's barely noticeable. Because they go right into it and then come right out of it within like 3 seconds. I mean, it's barely noticeable. But when a person is having a seizure, you don't want to restrain them because you can cause injury to them and yourself. But you do want to protect their head. If you see that they're about to hit their head, just kind of protect their head. But let the seizure run its course, and you never ever put a tongue blade in their mouth. I know back in the day they've done that, but that can cause more harm than good. Just let the seizure run its course, and after the seizure, especially if they're on the ground, you want to roll them over to the side and kind of open the airway. And if it's any fluids that's draining from their mouth, let the fluids drain from their mouth. For asthma, of course, they have shortness of breath and wheezing. You want to sit them in a comfortable position and give them whatever breathing treatments they have, their inhalers, their nebulizers, and you want to avoid anything or remove anything that triggers their asthma. The smoking, the pollen, anything that triggers their asthma. And if there's no improvement after they've had their breathing treatments or their inhalers, you do want to call 911. Okay, bleeding. For minor cuts, small bleeds, you can just wash the area with mouth soap and water. Use the antibiotic ointments or alcohol pads and put a Band-Aid on it. For severe bleeds or minor bleeding, you want to put pressure on the wound using gauze. But before you do, you kind of want to examine the wound to see what's going on. Use gauze. Put pressure on the wound. If bleeding seeps through, use more gauze. Just keep putting pressure on the wound. Keep using more gauze. Just keep putting pressure and using gauze until the bleeding stops. And then we're going to wrap it. Let's kind of start in the center here. Just wrap. Come up a little bit. You can come down some. Come back up. Come back down. And use surgical tape to secure it. And then after you're done, you can just kind of examine it, make sure there's no swelling, and you can ask the individual if there's any tingling or anything, or if it's too tight. For severe bleeding, you want to use a tourniquet. Okay, tie it as tight as possible, not too tight. Using a tourniquet, it kind of constricts the arteries to kind of help stop the bleeding. Just use the tourniquet tied about 1 inch or 2 above the wound, and just keep putting pressure on it till the bleeding stops, or until someone with more advanced training comes along and helps out. Okay, heat strokes.